I was born with a narrow spinal canal. It's called stenosis. And then as an adolescent, I contracted a degenerative spine condition. And even though I was able to participate in sports and be active as a youth, it caught up to me as I got into my 30s and 40s. And I just had trouble standing for long periods of time and also walking much distance. And in my profession as an attorney, I would stand quite a bit and I would walk to get to court and so on and so forth. So it was pretty uncomfortable and painful. And I was diagnosed with degenerative disc disease and scoliosis. And so I had a series of 2 decompression laminectomy surgeries initially, and they were 5 years apart. And then after that period of time, my spine structurally was weakened actually, and I developed a serious scoliosis, which is a curvature of the spine. And it got to the point where I could only stand for a few moments at a time and walk maybe 50 yards, 100 yards. It was difficult to stand in line at the bank or to go shopping. And of course, doing my work was difficult. And I was increasingly using narcotics and pain medications, as well as getting steroid injections into my back. And then I was eventually on morphine. And it got to the point where I needed to do something terminal to try and help my situation. I was quite reluctant though, because traditional back surgery, the outcome is not guaranteed. And I was really scared about going under for a fusion with hardware and metal and so on and so forth. And I had multiple levels at issue. And then I almost miraculously learned about Dr. Smith and the XLIF surgery and Invasive. And fortunately, he was on our health plan. And so we investigated that surgery, which was new to me. And so I did a lot of research about it and finally felt comfortable undergoing the knife. I brought my wife with me, her name's Jeanette, to the appointment because she's a big part of my life and we'd be doing this together. And we had gone through the initial, hey, these are what your X-ray and MRI and CT scans show and this and that and the other. And it got down to the point where I asked him, well, what's the alternative, doctor? If I don't undergo this surgery, what would my life look like? And he just flat out, in a very direct way, being compassionate, but in a direct way said, well, eventually, Brad, you'll just not be able to get up out of bed one morning. And I knew he spoke the truth. And boy, that just hit me like a sledgehammer. But I knew that was accurate because I was having trouble getting up every morning and increasingly more and more trouble. And so I knew what he told me was accurate and I had hope that there would be a real positive result. And then the other thing was I really wanted to improve my quality of life, be able to play with my grandchildren, go hiking with my wife, be able to work better with less pain, and just on a daily basis be able to enjoy life, because at that point life was really difficult. It's such a tremendous opportunity, and it's not without risk because one doesn't undergo a major back surgery without having some fear and some trepidation and some anxiety. In fact, a lot. But the potential for improvement is at such a higher level now with the non-invasive XLIF surgery and the Invasive support through their equipment, through their devices, and through their hardware, that it really is worth the risk to take because the payoff can be so great. And I'm not the only person. I happen to be what they call a patient ambassador for Invasive, and so I'm familiar with other patients who have undergone the same or similar surgery. Mine was a 4-level fusion with hardware surgery. And just to hear how their lives have been changed for the better is really heartwarming. And then we're able to share that with potential patients that may undergo surgery. And so to be able to talk with them and give them some hope is really an opportunity for us to pay forward what we've experienced personally. So the procedure is tremendous. Of course, it's only as good as the hands. And a person told me one time, do you want the surgeon that has the best bedside manner or the best hands? And I said the best hands, but in Dr. Smith's case, it's both.